If you've been reading the news, you may have noticed that there was a story about an 18-year-old boy in Utah who recently decided to regulate his own levels of insulin to help his parents pay for the cost of his insulin medication. This 18-year-old boy was a type 1 diabetic, and it was only later that his parents realized that he was lowering his doses so that he could help them pay for the rate and the price of drugs. So you may be asking yourself, why is this happening and what are the consequences? Medical prices and drug prices have been skyrocketing all the way back from 2012. We have seen a huge increase in prices, and this is affecting not only physicians, but also patients alike. And this young boy from Utah who was 18, his original dream was actually to go into healthcare and maybe be a nurse or a PA or an NP. And because of the rate and increase in his drug price of his medication, he is instead now working at a factory with his father. Now, his medication that he was taking was Lantus, which is the long-acting drug of insulin, and his prices went up from, about $60 a month to about $800 a month. Now, while for physicians that may not seem a huge increase, for people that are living paycheck to paycheck, this is a huge burden, especially when parents are having to work 2 or 3 jobs to pay for their own children's drug prices. Now, what type of message are we sending to patients and to future physicians that medicine isn't for the marginalized? It isn't for those with any pre-existing conditions because of the rates of drug prices that may prevent them from going into debt for medical education itself. Because of this increase in insulin that we have seen a 54% since 2014. And recently in Minnesota, there was actually a younger death of a young man with diabetes who was rationing out his medication, and his blood sugar increased so much that it actually caused his death. And that's something that the Attorney General of Minnesota is actually filing a lawsuit now. Now, when the American public was actually polled about this topic, over half of them thought that it was up to the federal government to regulate and mandate better pricing for drugs. And it's something that the Trump administration and previous administrations have constantly been considering and talking about. And even just this same past week, when we look at the State of the Union given by Trump, he said that to lower the cost of health care and prescription drugs and to protect patients with pre-existing conditions was the administration's one of their top priorities. Now, just in January, the House Oversight and Reform Committee and the Senate held hearings addressing drug prices on January 29th. And they've actually reached out and called 7 pharmaceutical companies to have them testify in front of court on February 26th. So hopefully we'll get some resolution, we'll get some indication of where these prices of drug increases have coming from. So now you may be asking, well, how is this affecting your patients and how is this compared to other countries? Other nations like London, their top 20 drugs that they have on the market are actually 3 times lower than what those same drugs are in America. And according to the Drug Accountability Office of Prescription Pharmaceutical Sales, have increased from 500 to 700 billion over the past 10 years. And you may be saying, yes, but that increase in drugs are going to pay for the research and development of new drugs, new pipelines, new medications, and new therapies for patients. But in reality, over those same 10 years, the amount of funding that has gone into R&D for those same pharmaceutical industry has only gone up from 82 billion to 89 billion. And so while we see that huge increase in drug price sales, we have not seen the subsequent increase in research and development, which is concerning to physicians and patients alike, trying to figure out where this money is going. Now, the Senate has been looking into this, and just this past week, we've also seen that there was a medication, you may know it by the common name, but is actually to treat Lambert-Eaton myasthenic syndrome. It was actually a medication that a couple years ago was free on the market, provided by a New Jersey-based company. After that company was bought out, there was a few licensing agreements that went back and forth, and this year they increased the price to $375,000 a year for that syndrome. And this is something that should be very concerning. And so many physicians and many patients are asking, where's this increase coming from? And we've kind of whittled it down to 3 different areas, and I'm going to have you highlight our Medscape articles that are online that I want you guys to check out that articulate some of this information a little bit more. But there's 3 primary factors why we see these increases. One, drug companies are not having the same amount of competition as you would expect. As a drug has a patent, the brand name drug actually has no competition for those several years after it's on patent. And after it gets off patent, most of the time, generics actually aren't being generated and being developed to compete with the current market prices. Medicare laws actually prevent Medicare from negotiating drug prices, which is exacerbating the problem. Now, the second major thing that is causing this is actually from a lack of transparency. And what that means is that insurance companies basically negotiate the fixed copays for patients and pharmacy benefit managers. This may be something that you've read about recently in the news. These pharmacy benefit managers are driving up the cost by offering rebates to patients. These rebates actually garner larger commissions for them and driving up the profits that both insurance companies and drug lawmakers are leaving patients and taxpayers to foot the bill. And this is a major issue that we need to consider and think about how to solve this issue. The third major reason is actually mergers and acquisitions of the pharmaceutical companies over the past few years. A lot of these companies have starting to merge, and what this is doing is expanding their drug portfolio, reducing the amount of competition, and increasing the bargaining power of these pharmacy benefit managers by passing the price ultimately to the patients. Now, the FDA is looking into the low-cost approval process, and there is now a drug czar that's being tasked out of the White House to look into this. And so currently there's 3 new bills that are being proposed that would actually allow legal importation of cheaper drugs from Canada to allow Medicare to negotiate better drug costs. And Congress is kind of set on trying to eliminate the middlemen of maybe removing these pharmacy benefit managers and driving down the prices. So for you, physicians, medical students, it's important to realize that when you prescribe a drug, these are affecting our patients. They're affecting everyone, and you have to be considerate of basically the socioeconomic status of your patient, what they can afford. And this is the conversations that you have to have in the doctor's office with them and say, you know, what can you afford? These what looks like the prices are and what your insurance can negotiate. If you go to the pharmacy and it's too high for you to pay, call back our office and we'll try to get you another medication that hopefully has a similar mechanism of action that can provide the relief that our patients need, that are maybe some of these life-saving treatments that they can get. So for more information on drug prices, I want to ask you to follow the Medscape links for all of the information that are provided in the show notes.